Hi, I'm Dr. Sulata Shenoy, psychologist and director, Turning Point, Center for Psychological Assessments, Therapies and Counseling, Jayanagar, Bengaluru. Schizophrenia is a mental disorder, a neuropsychiatric ailment which afflicts a small percentage of population but can have very serious and debilitating consequences. In schizophrenia, the person is unable to distinguish between fact and fantasy, reality and falsehood. So what the person does is, the person may experience voices, the person may be seeing things which other people are unable to see, and may be misinterpreting facts and also be leading a highly dysfunctional life along with a lot of emotional, behavioural and social upheavals that constantly impact or impair him as well as those surrounding the person. Schizophrenia is one of the disorders which was early recognized, and the person would be very often institutionalized because at that time there were no known treatments for schizophrenia except for putting them behind bars so that they don't harm themselves or they don't harm others. Nowadays we are finding a lot of treatable conditions in schizophrenia, and very rarely one finds that the person needs to be institutionalized, or even there are many halfway homes which, once the severity of symptoms of schizophrenia are addressed, then the person can go back to his or her own normal surroundings. So it has to be treated. I would first emphasize that schizophrenia needs treatment. There are many good medications, antipsychotic medications now which will address the symptoms and the person can lead a stress-free life. Now what one needs to do is to recognize the symptoms of schizophrenia. These are I would say of three types. The first is what are the prevalent or what are the existing changes in the person one can see. There may be changes in behavior, the person may be experiencing what are called hallucinations, that is, the person may be seeing images or hearing voices, and the person may be delusional, that is, the person may feel that something is happening, the person is being controlled by somebody else, and the person may be having persecution and paranoid thoughts, and this may even lead the person in his or her own self-defense or in response to those thoughts to act out in very bizarre ways, and the person may sometimes need to be restrained from acting out in such ways. Secondly, there is a certain lack, that there is a certain inadequacy, that is, the person may be withdrawn, there will be a social withdrawal, there will be a definite lack of say personal hygiene or taking care of oneself, going for a job or taking care of one's own people. So everything may get impaired. And thirdly, I would say there is a definite loss of cognitive function such as memory, judgement, insight, the higher executive functioning, ability to perform tasks, ability to understand and carry out series of instructions, all this would get impaired. So the person would end up not being able to manage himself or herself and be not in a position to take care of the needs of daily living. So while all of us do go through some periods of stress, maybe withdrawal or anxiety, anger, etc., or even aggression, but this would not be prolonged, this would not be so marked or significant or so different both in quality as well as in quantity from responses of other individuals. So one quickly gets back to the normal self once this disturbing period is over. In schizophrenics, however, this period would continue. Initially, it was thought to be a split personality. That is why the term schizophrenia. But however, we know that that's a totally different, that's a personality disorder, and schizophrenia is one of the known psychotic behaviors. And these can be very well treated nowadays only we have to follow up with the competent medical authority. We have to take the prescribed dosages and medications on time, and if one is a patient or one knows a patient who is near and dear to you, one needs to follow some coping techniques with the disorder. That is, one needs to read up a lot, one needs to get knowledge, knowledge is power, and one needs to know in which situations one can feel comfortable and do some lifestyle modifications, such as in eating, in sleeping well, in socializing, and in holding a responsible job or position, in behaving in appropriate ways in the manner that we all seek other people to behave. So, these are the coping techniques that one should follow, but this should always be done from a competent authority such as a neurologist or a psychiatrist, who would be the main person taking care of schizophrenics as of today.